Now I'd like to bring in Dr. Lauren Hughes. She's the State Policy Director and Associate Professor of Family Medicine at the University of Colorado. Dr. Hughes, welcome to the show.
Thank you very much for having me.
So listen, this modified quarantine, which some places have to do because they simply don't have enough staffing to be able to take care of the sick. Have you seen this in your situation also?
Yes, I have. And Dr. McKenney laid out very well the challenges that rural healthcare delivery systems face when it comes to their healthcare workforce. And the pandemic has certainly challenged this in many different ways. Number one, we have had to create new types of jobs. For example, screeners when you come into the clinic or into the hospital. And as Dr. McKenney mentioned, we have to be mindful of what happens if our frontline staff and others become exposed or sick and needing to have that backup. And in the past week or two, we have seen both North Dakota and Montana following the guidance from the CDC to allow nurses and other healthcare professionals that are asymptomatic but yet have tested positive for COVID to leave quarantine early and come in to continue taking care of patients. Because as Dr. McKenney mentioned, that's what's needed because some of these facilities, particularly in rural America, are so short-staffed.
Dr. Hughes, I don't want to go too fast by that. That's a big statement. Places like North Dakota have nurses who have tested positive for COVID. They have the virus inside of them, yet they're asymptomatic. They're not showing any symptoms. They're not sick. They're feeling okay. And they're still being allowed to work with patients in a hospital setting, a clinical setting, not just in front of the patients, but other healthcare providers, because the staffing shortage is so bad that these clinical environments can't afford for them not to work. This is bad on all levels.
That's correct. I agree with you in that it from a policy perspective, this worries me. It may ultimately be what's necessary to, as Dr. McKenney said, to strengthen that critical infrastructure needed to care for patients. But to your point, Dr. Ian, I worry about additional exposure to COVID-naive patients, to their fellow healthcare professional peers. And then from an operational standpoint, if you are bringing these nurses and other healthcare staff back earlier than their full quarantine, how are you going to make sure that they are restricted to certain areas of the hospital and taking care of patients? And will informed consent procedures be necessary so that a patient knows that his or her nurse or doctor actually is infected, with COVID?
Absolutely.
So those are the things that worry me, even though this may be a necessary measure to take.
Dr. McKenney, being in a town of 2,500 people, you probably know almost all of them because it's such a small town. And you being one of few providers, does it not worry you that you guys at some point are going to just reach a breaking point where you simply can't handle all the cases from a manpower standpoint, and you just may not have enough beds or equipment to be able to take care of people? What do you do then?
We've worried about that from the very beginning. We know that we have a limited number of people that are available to take care of our community members. We don't have any ICU beds in our hospital. We do take care of COVID patients, and we have done a great job, I believe, with the resources that we have. But we know our limits. We know that we're only able to take care of a certain critical level of a patient. If somebody needs to be on a ventilator, they truly should be at a higher level of care, probably in a more urban setting. And sometimes that's a hard place to find for these patients. The other day, we were trying to transfer a patient, and we had to call 11 different hospitals just to find a bed for that patient to be in. And 11 hospitals, those calls are not just quick calls. They are, 30 minutes to wait for a call back to say that they don't have a bed. You do that time and time again. And all the while, the patient is having trouble breathing, or they are worried, or their family is worried. And so these are things that we're dealing with all the time in this COVID pandemic, especially when all of the urban beds are full already. And so where is the place for our rural patients?